Hi, everybody. I'm Byron McNaught, Principal Technical Marketing Manager at F5, and we're here to talk about secure healthcare innovation with Microsoft and F5. It's a better together story as you're targeting potential accounts or customers in the healthcare space, how F5 can enhance Microsoft solutions and help you with just a better go-to-market and solution selling possibility. So we have a quite an action-packed agenda here. We're going to start with a level set and healthcare state of affairs. We're going to talk about some specific programs that we already have in flight, in particular Epic, which is huge in the medical field for electronic health records. And we have a play including Microsoft Azure, as well as some F5 security solutions to further add some robust protections there. We're going to talk about compliance, because that's normally the starting point in any type of security conversation. And then we're going to get into some of the weeds on how F5 solutions in particular can help with against attacks like ransomware or bot-driven attacks, which are only going to increase with the rise of AI. And before we jump into this focused webinar, I do want to introduce Tim Dorsch, who's the Alliance Lead for Microsoft from F5, and he's just going to sort of level set about our partnership and just hopefully give you an even broader picture of the possibilities that F5 and Microsoft has. Tim?
Thanks, Byron. As Byron said, my name is Tim Dorsch. I'm responsible for our global partnership here at Microsoft, and really wanted to just kind of level set on a couple of pieces. We're a globally managed partner with Microsoft, have been for well over 10 years. Our relevance in the security space is really tying into enterprise customers and those applications from a security and application delivery use case scenario. Across our partner bases between Microsoft and F5, we have a very common base. We're in approximately 80% of enterprise customers. And when we look at Microsoft's strategic account list of 500 accounts, we're in over 93% of those accounts. We're MAC eligible. We've been Global Partner of the Year for Marketplace, strong executive relationships and support across our executives at both companies, and several Azure integrations. We'll also show at the end, if you have any questions, you want to connect with us, you need to know who your peers are, need more information, you can reach out to Azure team at F5. And so one other comment to make is on the Fortune 500, Fortune 50 and those customers. The Fortune 50 base, F5 is in 48 of the 50 customer across that play. And so when you look at these different breakdowns and segments, you can see here on the screen where we play. And all of these customers look at F5 as a trusted partner, again, focusing in on application security and delivery, and especially in the new world of AI as that functions across the Azure platform. So that's a little bit about F5. Again, if you have questions, you can drop a note to us and we'd be happy to follow up. But with that, I'll turn it back over to Byron.
Thank you, Tim. And let's jump into it with a little level set on the healthcare state of affairs. And you can see there the theme that I'm focusing on is personalization and AI are coming center stage, which is similar to what we're seeing in other industries. This is actually a quote from the Executive Vice President of Research and Development at Epic at the HIMSS flagship 2025 conference last month. So it's pretty recent. And they're talking about agentic AI, which not to go on too big of a tangent, but this is sort of the next phase in AI. It's sort of beyond generative AI in that it brings to the fold things like memory, basically autonomous agents that can sort of implement certain business functions completely without, well, there needs to be human oversight, but think about like you have a website and you're interacting with a chat bot and it's able to actually fulfill and ship an entire order completely autonomously. That's sort of an example of agentic AI. And this is going to be huge in the healthcare space, from things like, offloading mundane administrative tasks from doctors to actually, implementing business logic within complex ecosystems. So it's front and center. And definitely there is a play with F5 and Microsoft in the AI space. But we also have a very pressing situation on the security front. And this is showing sort of over the years the rise of data breaches in the healthcare space. And this is sort of, counterintuitive to HIPAA and high tech and some of those regulations that we're going to cover earlier. And we know that some of these companies are sort of strapped. Their budgets might not be increasing, but hacking is increasing. You can see that curve is going up. That's not what we want to see. And as we're going to touch on later, some of the incidents are getting much more difficult for them to recover from. So before we get into some of the intricacies, we're going to talk about a program that we have right now and that we've had a lot of success with, including with Microsoft. And this is for secure and simplified deployment of Epic, which is a big application suite in the healthcare space. Think about it as basically complete personalization for patients, but at its core, it is electronic medical records, and that's subject to compliance. And definitely, those that compromised data can lead to regulatory fallout, tarnished brand, or even some sort of ransomware. We have seen that a number of cases. So the play from Microsoft, and I did my research, and it is compelling, to deploy Epic in Azure. So you're capitalizing on this, the scale, the performance, the baked-in security in terms of giving you that centralized dashboard, helping meet compliance, and just being able to tap into that Microsoft ecosystem for innovation, in particular on the AI front. In fact, Epic is using Microsoft AI under the hood. So there's definitely some synergies there. And on the security front in particular is where this better together story really comes to play, because in this space, as with others, it's highly regulated. There's multiple compliance standards, and there's all sorts of attacks. So we're going to jump into the details on that, but something that might be a little bit surprising to those who haven't been in the weeds. We've all heard of HIPAA. We know we have to protect health records. We know disclosure of people's personal information, especially something as sensitive as that is bad. But HIPAA doesn't in itself have sort of the teeth and the regulatory enforcement mechanism. So there's actually other regs such as high tech and certain state level ones to sort of make this more enforceable. So there's actually some predictions in the upcoming year that there might be some incidents in the healthcare space that would actually lead to tangible fallout, and that might address that curve I showed earlier that's untenable. We cannot continue to have these data breaches increasing and the recovery time going down. And that's one thing that F5 in particular is focused on with our solutions, is to help meet that compliance, which is normally the baseline for any type of security conversation. And so what does this better together story mean? And again, this is based on research that I've done on documentation in Azure, and Azure is a global partner of ours. It's Tim's primary job. He has a whole team supporting him. So this is no knock on Azure at all, but it's similar to sort of the all-up responsibility model of the cloud. You're gaining this infrastructure at scale. You're gaining this very robust level of protection. Microsoft is known for having a premier threat team in terms of how they do research and how they respond. But you're not actually going to be able to meet some of these critical compliance regulations just by deploying in Azure. And in fact, the disclaimer is directly from the documentation. You're responsible for ensuring that you achieve compliance with PCI DSS, as an example. We also talked about HIPAA and high tech. Those are three different regulations, but the net is you need to protect sensitive data. You cannot have it be exfiltrated, and as we're going to talk about in a few minutes, that can happen in a variety of ways. So insert F5 into the equation. Now you have that economies of scale, this robust infrastructure for performance, for reliability, for the security in terms of having that centralized view and that Microsoft threat team. Augment that further with F5 solutions that in particular look to prevent risks that can exploit the patient health records that we're trying to protect. And I'm going to get into some examples of how this is actually happening from some third-party research that aligns to the industry, but also F5's own research. So in healthcare, something that was actually surprising to me, because I've been working in the security space for about 10 years, but kind of been up until recently sort of a jack of all trades all over the place. I left F5, went to Cisco, came back, so it sort of gave me a pretty broad view of the security landscape. So I knew about ransomware, but I associated it with malicious emails, social engineering, phishing, getting people to click a link. But in healthcare, we find that the highest threat vector for ransomware is through exploited vulnerabilities and compromised credentials. So think about your Epic healthcare application as sort of the beachhead into your entire medical record database and all the services that the organization leverages that can be exploited, especially if there's a public-facing website or even API calls through a mobile app or some sort of ecosystem integration. And what we're also finding is that recovery is taking way longer. It's just, I think everybody on this call would agree it's unacceptable, and it is actually increasing. So in 2024, which is not too long ago, I know it seems like it might be, 37% of healthcare orgs said it took more than a month to recover from attack. And ransomware is in particular nefarious. Not only is it, you know, exploiting, very sensitive data, patient records, people's personal sensitive information, but a lot of these schemes, they look to do things like, hey, let's delete the backups that they're saving in the cloud. Let's basically force them to have no other option but to pay the ransom. So it's very serious. We've seen some quick recoveries in the space, but in general, just due to the sophistication and due to oftentimes by the time it's known that there has been a breach or an incident, by that time it's too late. The malware has spread. The data is encrypted, and oftentimes these orgs just feel like they are at the mercy. But the good thing is, with F5, if in particular with Epic, we already have a validated design with how we can have our web application firewall front end Epic to prevent application vulnerabilities, things like cross-site scripting, SQL injection, attacks like that. But it also has a baked-in integration into our distributed cloud platform for as-a-service bot defense. That's going to, in particular, monitor the dark web, prevent any type of attack that's using compromised credentials or any type of automation at all. It's not based on any type of attack. It's essentially based on what the attacker is doing, and it's sort of taken a plug from the way Microsoft does security. Just analyze enormous amounts of telemetry to sort of glean that threat data to be able to take action. So we already have a very widely deployed offering from F5 for a web application firewall plus bot defense that is very pertinent to ransomware and healthcare because, like I said, that's where the threats are actually happening versus in other spaces, like I said, maybe through email, maybe through endpoint. That still happens, but because of the reliance on applications now, and that's going to increase with AI, that's really where the focus needs to be from a security front. Similarly, healthcare is very targeted by bots and malicious automation. So this is not the same as ransomware per se, but the end game could be in terms of, compromised business logic, compromised records, abuse of functionality. In our threat research team, we actually have our own, like Microsoft. They just released a sort of a mega report, if you will, showing that healthcare is the second most targeted industry for bots and automated attacks that target web properties. So there is some delineation based on, mobile apps and API-based systems versus classic web apps, but those web apps in healthcare in particular are heavily targeted. Web scrapers, which, think about what Google does, it's going and pulling information off various web pages in order to show you good search results. Well, scrapers can be implemented through bots by attackers for a variety of reasons, but it's ultimately potentially scrubbing and capturing information that it shouldn't be able to have access to or shouldn't be able to do, especially at scale. We're also seeing AI sort of further that scale and sophistication. We also see a lot of bots targeting the login flows. Think about credential stuffing, trying to log into the patient portal because that's effectively where that sensitive data is hosted. These patients have a profile, name, address, perhaps social security, other sensitive information. So that's a highly sought after target for attackers, and they're using bots and they're using AI to scale their campaigns. And we're also seeing that the large language models that are under the hood for this generative AI and soon to be more mature agentic AI, those can be targeted by bots too. And so F5 bot defense, it's based on sort of a cycle, if you will, of capturing telemetry, analyzing, looking for trends, understanding that, yes, this is an actual malicious attacker, looking at intent because they're using, some sort of, program in a malicious way. So we have programs that are used for testing websites, for testing APIs, but those can be used for malicious purposes. So any type of automation, spoofing, signals to try to present like, I'm a real person, I'm coming from a real browser on a real device. Bot defense is really good at being able to detect that and to also maintain resilience no matter what attackers do. If they pivot, say, okay, we can't get through the website, we're going to look at the APIs, or we're actually going to escalate now and use this more sophisticated technique. We're proven in a variety of regulated industries, including healthcare, to provide that resilience to maintain protections no matter what attackers do. And with that, I'm going to turn it back over to Tim to sort of level set on where you go from here. Tim?
Thanks, Byron. So to close out, again, if you want to get connected for co-sell conversations on the accounts that you manage in the healthcare space, if you need to know who your F5 seller is or just need more information about products, please reach out to us at azureteam@f5.com. We'll be happy to follow up with you and engage. And with that, we'd like to say thank you for your time. Have a good day.